Respected chairpersons and my dear colleagues, we are presenting our experience on pregnancy-related sepsis in our institute. Sepsis is rare in obstetric population. As you all know, the sepsis is one of the leading cause for maternal morbidity and mortality, and it leads to significant perinatal mortality. Assessing and recognizing of the sepsis at early stages is difficult, leading on to the delay in treatment of sepsis, and further it represents a continuous challenge for both the obstetricians and anesthetists. The objective of our study was to analyze the incidence, to find out the causes of sepsis in pregnancy, and to evaluate maternal morbidity and mortality. We did a retrospective study over a period of 8 years in Fernandez Hospital. The Fernandez Hospital is a tertiary referral center, 150-bedded hospital with 5,000 deliveries per year. Coming to the results of my study, we had total of 28,865 deliveries in this period. Out of this, 1.6% of the cases required ICU admissions, and 0.2% of the cases were sepsis-related, pregnancy-related sepsis. In our group, the mean maternal age was 25.7 years. Most of the cases were in the younger age group, and we had only 3 cases where the age was more than 35 years. Coming to the parity, 70% of the cases were nulliparous. 30% of the cases, the parity was between 1 to 3 years, and most of them were in the younger age group. When we looked at what is the gestational age and diagnosis of sepsis, it was most commonly, it's the intrapartum 76%, and miscarriage-related cases are only 7%, 11%. And we looked at the booking status of our group, 70% of the cases were referred, only 30% among the booked cases. When we find out what is the cause for sepsis in these cases, most common is the chorioamnionitis, 17%, followed by urosepsis in 13% of the cases, and intrapartum pyrexia was seen in 8% of cases. We had coexisting complications like jaundice in 22% and preeclampsia in 8% of the cases. Most common organism isolated in this group was E. coli, that's in 13% of cases, followed by hepatitis E and Klebsiella in 5% of cases each. The organ injury is common in sepsis complicating pregnancy, and most common organ involved in our case series is coagulopathy, that's a disseminated intravascular coagulation in 38% of cases, followed by hepatic failure and renal failure in 36% cases each. When we looked into what is the organ involvement and how many cases required the organ support, we found 26% of renal failure cases required renal replacement therapy, and 71% of respiratory involvement cases required ventilation, and multi-organ failure was present in 38% of cases. Coming to the maternal mortality, we had total deaths. In our total deaths are 10 out of 63 cases, that's 15.8%. During this period, we had 17 maternal deaths, and the maternal mortality rate of our hospital was 58 per 1 lakh births, and the sepsis was contributing to 58% of this maternal deaths. When we looked at the booking status, 80% of the cases of maternal deaths were referred cases. We had 2 patients with hepatitis C complicating pregnancy and had maternal death, and 2 cases of dengue hemorrhagic fever leading on to maternal death. Coming to the neonatal outcome, we had total stillbirths of 24% and neonatal deaths of 17%, and take-home baby rate was only 73% in our group. The mean gestational age at delivery was 33 weeks, and the mean birth weight was 2 kg. The perinatal mortality in our hospital was 18 per 1,000 births. Pregnancy-related sepsis cases, there was very high maternal mortality rate of 377 per 1,000 births. Coming to the conclusions of my study, the maternal mortality in sepsis is around 10 in the 63 cases, and maternal death is the leading cause for, sepsis is the leading cause for maternal death. Almost 58% of maternal deaths were due to sepsis, and 80% of the times it's referral patients who landed in maternal deaths. Out of 71% of respiratory involvement cases, 71% needed ventilation, and 26% of renal failure cases needed renal replacement therapy. So I conclude that early referral, diagnosis, and goal-directed therapy saves life. It's more important to have the sepsis awareness program and use of modified obstetric early warning chart in the referral areas from where we are getting the cases, so that we can get the cases early recognized and early referred to the institute for better outcome. Thank you.